Thank you, everyone, for joining us this evening. To give a quick introduction, I am Jennifer Merlo. I am the Director of Veterinary Affairs for Fear Free, and I oversee the Practice Certification Department as well. We want to thank everyone for joining us this evening, but especially thank our guest speaker, Dr. Neilson. Dr. Neilson earned her DVM from the University of Florida and completed a residency in clinical animal behavior at UC Davis, becoming a diplomat of the American College of Veterinary Behaviorists in 1997. She did own and operate a veterinary behavior referral center in Portland, Oregon for 14 years before joining Elanco in 2011. So Dr. Neilson is here with us tonight to talk about olfactory experience of pets and a bit of an overview of Elanco's portfolio of canine respiratory disease vaccines. So welcome, Dr. Neilson.
Well, thank you so much. And I am thrilled to have all of you joining us, because this is going to be, and I try to think about it, I was like, how do you actually frame this? It's going to be a stinky, a smelly, fabulous time together as we're talking about olfaction. And as pointed out, for conflict of interest purposes, I am an employee of Elanco Animal Health. So, when I think about the olfactory experience, this took me back when I was just a little girl, and I had a little beagle puppy, and when she was 6 months of age and going in for her ovariohysterectomy, I remember that I took a worn shirt, so a dirty shirt, with me to the vet. I'm sure the vet was thrilled, but to leave with her during her stay so that she had my odor with her. And I think back and think that, gosh, even as a child, I knew the potential power of odor or scent for her. Now, I don't know if it helped her in any way, shape, or form on that day, but once again, it speaks to this knowledge about the importance of scent and smell in our companion animals. When we think about dogs, they have a long history of being known for their amazing sense of smell. So if you did have a needle in a haystack, probably the best way a dog could find it is actually sniffing it out of there. And so they have estimated between 150 million and 300 million olfactory neurons. So they are chock full of capabilities for smelling items. And in fact, they are so skilled that they can detect one rotten apple in 2 million barrels of apples. That's a capacity that is almost 100,000 times that of our inferior capability as humans to smell things. So an amazing capacity. If you put that into essentially a visual analogy, if what we could see, for example, clearly maybe 1/3 of a mile away, a dog could see then 3,000 miles away, right? So it's quite mind-blowing, the potential for their capacity to smell. And once again, fairly well recognized. People know that dogs have good olfactory capabilities. There's actually a study that was once done, which always just, once again, amazes me, that a dog can actually detect a fingerprint and distinguish that fingerprint from an individual 6 weeks after it has been deposited on a surface. So amazing capabilities. When we think about olfactory acuity as compared with, or we mix in the felines there, we know that, once again, for humans, we have comparatively very poor capacity to detect odors compared to our feline and canine counterparts. Now, felines are known to have about 80 million receptors, once again, less than the dog, which is somewhere between that 150 to 300 million receptors, and humans have a mere 5 million. But the interesting part about cats is that they actually have more varied receptors. And so one of the theories is that that variability in receptors, olfactory receptors, allows them perhaps to discriminate scents even better than dogs. So regardless, once again, our cats and our dogs are superior to humans, and it would not surprise me, because they are felines after all, that maybe they do have a more discriminatory olfactory ability than other species. So I want to just delve for a few moments into what's actually happening when that little nose starts sniffing away and an odor is present. And we do recognize that most mammals, including our canine and feline patients, have two olfactory systems. They have what we call the main olfactory epithelium. And so that's going to be detecting volatile odorous compounds. So if you think about it classically, it's the things we smell. And then there's the vomeronasal organ as well that they have, and that's detecting these pheromones or semiochemicals that don't have a perceptive odor to them, but they have a lot of meaning for our pet population. If we look at a little diagram here on the dog that shows you essentially the areas of interest, you can see that that vomeronasal organ, it lies between the hard palate and then our respiratory tract. So it sits in there, and there's a nasopalatine duct that actually is a little narrow duct that goes from behind the incisors and then into the olfactory area. So you got the mouth, vomeronasal organ, and our respiratory tract all really connected so that that our animals can interpret these odors appropriately. And then, of course, we have the olfactory bulb that sits a little bit farther back. Now, a couple of fun facts. When a dog, I should say, studied in dogs, takes in a breath, about 12% at the top of that breath actually goes directly to that olfactory epithelium. And the molecules congregate there and settle there, and that's where we get some interpretation of the odor. The rest of that air goes down into the lungs where they need it for oxygenation. There's also a bias to the nasal passages, or so the nostrils. So when dogs first sniff, they actually sniff more through the right nostril than the left. And if that odor that they kind of are initially sniffing gets recognized, right, as a familiar odor or non-threatening odor at that point, it actually will then, they'll kind of shift and they'll start sniffing more through the left bulb. If it's something that's potentially dangerous or they have a negative association memory with it, it stays on the right side. So that's just a little fun fact that you can maybe share the next time you're at a party if the conversation's getting a little dull. So there is a bias to their nasal passages. Beyond that, I'm not going to get into all the details, and quite frankly, a lot of them we don't even know about how olfaction happens in our patients. But we do know that it is a very complex system involved with neurons and modulation and axons and different parts of the cortex of the brain interpreting things. And one of the things about smell that's so unique, and I think it makes it so fascinating, is that it is tightly tied to the limbic system. So kind of your basic brain, if you will. And what that means is that when our patients are faced, and us too, with an odor, so we get faced with an odor, before we even consciously realize that we have smelled something, we're already responding. Our brains are already tracking it and knowing if it's familiar, threatening, etc. So it's a very, very powerful sensory system because of that tight connection with our limbic system. And then I'm going to share some info with you that is a little disappointing, I think, sometimes when I think about it. What we know about the olfactory system in our patient population is just a tiny bit. We don't know so much about it. Now, that said, there's been some exciting advances on what we do know, and I'm going to share that with you tonight. And so, or today, whatever time you're watching this, so that we can utilize that information to the benefit of our patients and ourselves in our practices. But there's still a lot more to uncover. There's actually a science about aroma, and it's called aromacology. And it is the science that studies the psychological and physiological effects of inhaling aromas, and then examines, with the use of fragrance technology, the feelings and emotions produced by those scents, stimulating those olfactory pathways. So this is an area of study on the human side. And you may wonder, in some ways, why is it an area of interest or study? And the reason, one of the reasons, there's multiple, but one of the drivers for this is that, in fact, there's a whole area of marketing called aroma marketing. Now, you may, when I say this, start to think about experiences you may have had with exposure to aromas in certain venues, maybe places you stay at, maybe places you shop. And so historically, and this was decades ago, people started to realize the first thing, I think one of the first things they realized, that if you were trying to sell your house and the realtor put in chocolate chip cookies in the oven, so then the house smelled like chocolate chip cookies, those houses sold more quickly and for more money relatively. And what we've discovered since then, or what the science has led us to understand since then, is that even though that worked in that situation, that in fact those complex odors like chocolate chip cookies, they're a complex odor, may not be as powerful as individual or simple scents. And so there was one study that was done of 402 shoppers in a Swiss home decor store. And what they found was the shoppers spent more money when the store was infused with a simple orange scent instead of a complex citrus scent or no scent. So once again, you think about your experiences when you go out into the world and maybe someone's trying to use scent to influence your behavior in a marketing strategy way. And one of the reasons, once again, that people are looking at scent is we've gotten overwhelmed with visual stimuli and auditory stimuli. And so this is a unique area that they can tap into. And once again, it goes directly into our brains, that limbic system, and gets quite a powerful potential emotional response from us. And of course, they're always looking for the good emotional response. I am traveling right now, so that's why I look like I'm in a hotel. I am. When I walk into the lobby, certain hotels will have a scent associated with them. And this has been tested in multiple different countries and in different hotel chains. And what these hotel chains have developed are, in some of them, infusing a scent into the lobby area. So when you arrive, the idea is you'll have a pleasant experience, but you'll also have this association with the odor. And when they study this, and they've studied it once again in multiple different places, what they find is that if they have infused a scent, and these vary based upon the location, but they can be, and they vary also based upon the hotel chain. So if you're a business traveler, you'll have a different kind of scent than maybe if it's a resort location. But what they found is that when they infuse these scents and then they later interview their hotel guests, is that those that are exposed to the scent have more positive feedback about the experience. But perhaps more importantly to the hotel chain, it triggers them to say that they are more likely to return to that particular location for another stay. So once again, can be very powerful. Now, I know what you're thinking. Sometimes you've walked in somewhere, and I don't want to disparage any stores, but some of those, those candle stores or those bath stores, Bath and Body Works, that has that odor that just kind of hits you in the face and you think, oh my gosh, that's overwhelming. There is the potential for that as well. So intensity matters. And once again, they test some of these scents to see which ones are the most pleasing. Another study I found fascinating in this area was about in the restaurant industry. And in this particular, these studies were done in France. And so that is important because there's some context associated with typical foods that they eat, but they had the subjects actually in a holding area, so a room that was getting infused with a scent, but it was below detectable limits. So in one study, they had a melon odor, and then they had a matched pair that had no scent added, and then in the other study, it was pear odor and no scent added. And what they discovered was that if the individuals, which once again did not report ever having appreciated smelling any melon or any odor, but that was infused, those people ordered more salads and less fatty starters, so in that first course. And if a pear order had been infused, they ordered more fruit-based desserts, and pears happen to be a common fruit used in desserts in France. So just again, fascinating the impact it can have on people in various settings. And of course, it's also been studied in the medical settings for people. And there's been a series of studies here. One of them was looking at people in the dental office, and if they had a light odor infused into the dental waiting room, that those individuals were more comfortable, experienced less anxiety during their dental exam. Certainly something I could probably use because I get nervous at the dentist. They did a study with a pediatric hospital, and in that particular study, they exposed a scent versus no scent. So they had a control group, and the scent group, which was either exotic fruit or citrus scent, improved the overall hospital experience as rated by the individuals. And then finally, another study was done in the waiting room of plastic surgeons office, and the studies, the research subjects said that if they got exposed to the scent, and the scent in this case happened to be lavender, that it reduced their anxiety as compared to a control group. So there are some medical experiences in humans that we've been able to, or have been captured and reported in the data. It's easier, of course, to do some of this work in people than our patient population, because people can fill out surveys and give you direct feedback on how they felt. And of course, we have to interpret our patients' behavior. It's just a little trickier for us to get that primary response. But it does not mean we don't have anything, and that's what I'm excited to share with you today. And some of this data is quite recent, and hopefully I think you're going to learn some new things and be reminded maybe of some other strategies that you may have used in the past or are currently using, and how they may be impacting your patient population. So several of our studies that I'm going to share with you, not all of them, but many of them do use shelter populations. Obviously, it's a group of animals in a common area. So we've got the ability to get quite a lot of animals studied. We have some veterinary studies as well, and veterinary clinics. But in this particular study, we have 150 cats that are exposed to different scented cloths introduced into their kennels. And there were 4 different cloths that were introduced at different times into their kennels, and they were recorded to see how much they engaged with the cloth and their behavior associated with that particular odor. So one of them is just a piece of cloth with no added odor to it. And then some of them had the scent of rabbit. This was actually rabbit fecal material was rubbed on the cloth, and then catnip cloth and a lavender cloth. And as I mentioned, the investigators videotaped and scored their behaviors. And what they found was that the cats spent more time, both with actually the prey, or the catnip cloth was the top, and then prey was second, so that rabbit odor, rabbit fecal odor. And they spent more time sleeping with the catnip cloth post interaction with it. And once again, the prey also kind of had that very similar response, but the catnip was higher on engagement. And the conclusions of the studies from this paper said that the catnip odor may hold merit as environmental enrichment. Now, for those of you who are catnip fans and have not yet heard of the new catnip on the block, which is not catnip at all, it's a different plant, but it is silver vine. I want to share with you some of the data about silver vine. So you can see here, this is a published paper that looked at cats' response to multiple different odors here. And we'll just show you on a visual what this looks like. There was a control group. So in the case of this study, they presented the items two ways, but primarily they put whatever the item was in a sock and then tied the sock closed. So the control was a sock with no added items to it or no odor item to it. And then they had a silver vine gall powder in one. They had dried catnip leaves and flowers in another, and then honeysuckle, and then valerian root. And what you can see, this is actually a mix of cats from different settings. So there was a sanctuary, a shelter. Some of these cats were done in the home, and there were some cats in a veterinary hospital where they were tested with these various scents. And similarly to other studies, not with exact same strategy, but they were watching the cats after the item was put in and videotaped and scored on their interaction with the item in response to it. I do want to point out that one of the limitations of this study is that the primary investigator was not blinded, which is unfortunate. That would have strengthened the study design, but every study has its, no study is 100% perfect. So just keep that in mind as we're reviewing the results here, that the investigator who scored most of these was not blinded. And what they were looking for was what they called a positive response or no response to the odor. And so all the items listed in the middle here, sniffing, licking, shaking your head, rubbing, etc., were considered positive responses. And they actually had a gradation in the positive response if it was particularly strong or kind of there, but not quite as strong. So big check plus or big plus, medium plus, and then again, no response to the odor. And what you see here are the percent of cats who demonstrated a positive response to the various items. So the control was a good control, plain sock, nothing happened with it. So we got 0 there. And then you can see somewhere the honeysuckle and valerian root got about a 50% response rate. And then we're getting closer to 75% with our silver vine gall and catnip. And that was statistically significant for silver vine gall and catnip. It was more engaging or more positive of a response than were the other two scents provided. On top of that, another finding was the cats who got the silver vine gall when they were exposed to the silver vine gall, those had the most intense response. So that very big plus sign on the positive sign. So together, when we put all that together, we have this idea that, wow, silver vine gall may be, I call it kind of the new catnip on the block. Now, I do want to point out that silver vine gall or silver vine, I should say, is a plant. It's in the kiwi family, and it has a few other names people call it by. Sometimes they call it Japanese catnip, cat powder, and I don't know if I'm pronouncing this right, but matatabi might be the other name for it. And as is true with most plants, there are several parts to them, right? We have the leaves, we have sticks, and then the gall is actually the fruit. But it's not just the fruit. Gall is actually a dried fruit from the plant or the tree that has been infested with gall midge, these little midges that infest it. And so what it's done is taken this fruit, and instead of being a smooth fruit, because they got this infestation, it's all kind of gnarly looking, irregular surface to it. And so the question is, do all of these work? Like, do cats respond to all these various components of this plant? And the answer is probably not equally. When those gall midges actually attack the fruit, what happens is that the chemical in the plant that appears to trigger the cat's reaction gets concentrated. It kind of has a response, the fruit, it gets more concentrated with the midge attack. And so that's why silver vine gall, either getting the intact fruit, which is about the size, gosh, of maybe not quite a quarter, nickel to a quarter round, getting those is probably preferable to the sticks or dried leaves. When they tested sticks and dried leaves in cats, most of the cats did not give the same response. And if they just used the fruit that hadn't had the infestation with the gall midge, they also did not respond as favorably. So I had to go out and buy it all. So I'll just show you. Hopefully the video will play over the internet. I know it can be tricky. So my cats loved the silver vine gall. I bought the sticks, not so interested in it. And what I've noticed, and I don't have a big enough population to actually speak to this confidently, but you know, with catnip, how they sometimes get really edgy and a little more aggressive. And my cats will do that with catnip, but I do not see it with the silver vine gall. So it's just something to think about as well. Okay. So if you haven't been using silver vine gall, it's something to maybe add to your list. By the way, when you're looking at cat toys, a lot of them now say catnip and silver vine on them, but those are probably the leaves. They don't usually distinguish what parts of the silver vine are in there, but it is starting to pick up in the commercial space. You'll start to see probably silver vine noted on some cat toys. So remember when we started, I was talking about taking my t-shirt and taking it with my little puppy in for her spay surgery. One of the questions is, can owner scent items reduce feline stress? So the scent item, of course, being maybe an unwashed object, piece of clothing with an owner's scent on it. Go out for a run, get a nice sweaty t-shirt. Will that help your cat? Well, here's what we know about the owner, at least, and their ability to reduce kind of stress in a cat. And that is that we know that if an owner is present, it can provide what people are terming the secure base effect. So essentially, it can provide comfort and reduce stress in a novel or unfamiliar environment for a cat. The question is, can we just take that shirt, not be there ourselves, and can that help cats? So somebody looked at that and did a study, and what they looked at 42 cats, and once again in a novel environment, left a piece of owner's clothing with them and tested them. And what the answer was is that it did not, the clothing itself did not appear to provide that same secure base effect as the owner's presence. So could it provide something? Maybe, but it did not seem to equate to the owner being there. Do cats have scent preferences? A question that I actually was years and years ago when I was working with a company that made cat litter. They were considering, because at the time citrus scented items were very popular in the cleaning supply areas of people, they were considering making a citrus scented cat litter. And I said, wait a minute, I don't think that's going to be a good idea. But I went through the literature, contacted people at universities, and there was just a paucity, essentially very, very little to almost no data on cat scent preferences. So I went out to try figure out, what do cats like? So I tested these 5 scents. In addition, I had a control, which was a no scent situation. And essentially, I introduced the scent to the cats and then scored them on their engagement with the scent, if they were avoiding or neutral with the scent, over a 30-second time interval. I'll show you a few of those videos. So this is, the first one's going to be a piece of, there's going to be a cotton ball in there with some cedar scent on it. And then the next introduction will be control, which is just a cotton ball inside a little hair curler. You'll see it as it goes in. And then we score them once again. Now, this is a blinded study, so I didn't know what they were getting at the time I was scoring them. So this cat's doing quite a bit of engagement, smelling in the cedar. You can see there's challenges with this study design because it's a shelter environment and it's open. So people are walking by thinking about adopting cats. This was actually the control scent. Now, when we introduced the scent into the kennels, we just put it about a few millimeters from the, centimeters from the cat's nose, and then they could approach it. And you can see this cat loves having something with no added scent to it introduced into its kennel, and it's kind of chewing on the roller. And when we tested citrus, I got my answer about what cats thought of citrus. So here's the kitty cat. It was citrus. We put it in, the cat. And I know cats can't fill out questionnaires, but if this cat filled out a questionnaire, I think he would say, oh, no, 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 I do not like that. Definitely avoidance. What's really interesting is the next scent I try to introduce to that cat after citrus, the cat would not participate. He withdrew from the study because anything that we tried to then introduce in that same format, the cat had a negative experience with the citrus and swatted it away. So we actually lost quite a few cats from the study based upon their, it was a randomized order, but once they hit citrus, they wouldn't actually participate anymore with future scents. So because of the small number, we did not actually establish significance for neutral or avoidance behaviors, but citrus scent was the highest scoring for avoidance. And I also assigned a subjective score to the cats, whether they seemed to like the scent. And what I found was control and bleach were the most liked scents. So it was an interesting, at least, start into that area of scent preferences in cats, which had been, as I said, quite ignored prior to that. Now, many of you are probably already using Feel Away in your clinics, and here's some of the studies that triggered us to adopt it in our facilities. This is 20 cats coming for veterinary visits. They were going to be kenneled, and half the towels got sprayed with Feel Away. The other half got a placebo, just the base with no active pheromone in them, put into the kennel with the cats, and all cats were videotaped for 125 minutes. And what we found, or what was found in that study, was that the kitty cats who got Feel Away actually engaged in more grooming episodes, episodes of having interest in food and actually eating compared to the placebo group. And we interpreted all of those behaviors, grooming and eating and interest in food, as being more relaxed behaviors in our feline population. And I think that's probably a fairly safe assumption. And then another study, these were 87 exams done on cats that prior to them coming in, the treatment table in the exam room was treated either with Feel Away, placebo, and we have the control group as well. And what they found in this study was that they tested stress scores, which is a scale of 5 down to 1, which at 5, the cat is characterized as being terrorized, and then relaxed down at the lower end of that scale, fully relaxed cat. And what you can see is that the cats who were exposed to Feel Away had a statistically significantly lower cat stress score. The other interesting part of this study was that they asked the owners to report whether they thought how their cat did, essentially, so how comfortable they were. And 40 to 50% of the cat owners whose cats were exposed when they were exposed to Feel Away said that the cat was more easily handleable, seemed more comfortable, versus only 3% of owners when they were exposed to placebo stating that. So not only did the cat stress score reflect a better experience when the cats had exposure to Feel Away, but in fact, the owners appreciated that their cats were having a better veterinary visit, in their opinion. Okay, let's switch to dogs and their nose. So one study here is going to be study around car travel excitement is the term they use. So they recruited a group of dogs who had car travel arousal and excitement, so panting, pacing, those types of behaviors in the car. And each dog took 6 trips. So 3 of those trips were considered control trips. They had no odor introduced into the car. And then the other 3 trips had lavender. And these were randomized for order. They videotaped the behavior of the dogs during their car travel, and those were later evaluated by behaviorists. What they found was that when the dogs were exposed to the lavender, they spent significantly more time resting and sitting and less time moving and vocalizing. So an improvement, if we will, in that excitatory arousal or maybe even anxious behavior. Sometimes hard to tell the difference between arousal, excitement, and anxiety. And many of the behaviors they were coding could have been actually anxious behaviors. So back to the shelter setting to look at some more olfactory stimulation and its impact on dog behavior. In this study, there were 55 dogs that for 4 hours a day for 5 days got exposed to these various odors: chamomile, lavender, peppermint, and rosemary. And what they found was that when the dogs were exposed to chamomile or lavender, they exhibited more resting and less vocalization, as compared to peppermint and rosemary, where the dogs were standing more, moving and vocalizing. So almost peppermint and rosemary were more stimulatory type odors that were exposed. And we know, at least in our facilities, most of the time we'd like our dogs to be calmer, resting, and not barking as much. So once again, that would reinforce the use of chamomile or lavender as a scent. We talked a few minutes ago about the lack of data about feline scent preferences, and there's been a little more work done in dogs, but we still have a long way to go with dogs. And there's a very interesting paper with a small number, so 14 dogs, but they exposed these dogs to 32 different scents and over a course of multiple trials for each of these dogs. And what they were scoring was orientation to the scent. So did they go to it? And then how long did they spend with the scent and how long did they sniff the scent, to try get a sense of what do dogs like. When the investigators were designing this study, it really was for the basis of looking at different products that we use on our pets, our canine pets, like shampoos, and the odors that we're putting on them, and are we creating those products with odors that dogs may actually like, or could they be problematic? So here's all the scents they tested. So you can see there is a long list of items here. So lots and lots of things tested on these dogs. And I'll share with you the two most attractive scents. And these were actually what the investigators thought would be what they would consider the positive controls. So they were expecting the dogs to like these. And the first one is food, so meat flavoring, no surprise there. And the second one is described as beaver clothing, castoreum. And we'll return to that in a moment because I wasn't familiar with that. And so I did a little investigating. But those were the most attractive and what, once again, the investigators expected. But when you look at all the other scents that are on here on the slide, what you saw was that some of the other ones rose to the top for increased interaction. They were blueberries, blackberries, mint, rose, lavender, and linalool. Now, you could say, well, blueberries and blackberries, those are kind of food, so maybe they like that. But there were other, like strawberry, that didn't rise to the top, and raspberry. So it's interesting that these were the scents that at least the dogs spent the most time with and seemed the most interested in. And there's theories behind why some of these may be more attractive to dogs, like could they in the wild infer some type of maybe benefit to them if they were around mint, for example, or rose? Could it give them some maybe anti-parasite kind of protection? Or so once again, hypotheses are there for that, but these are the findings of the study. Now I'm going to take you a little bit back to this castoreum because I, again, was very curious about this. What is it? Well, here's what it is. Castoreum is actually anal gland secretions from beavers. And what I was unaware of, but there was a paper published in like 2007, I think it was the Journal of Toxicology, that was looking at these secretions from beavers, and they are used quite routinely in perfume industry because once those secretions are treated, they actually have a very unique vanilla scent, musky vanilla scent that's very popular for high-end perfumes. So that said, they are also used in food products. And this is where it gets interesting because a National Geographic investigator, journalist, actually got a hold of that paper and started running down that route. And in fact, found that they are by the USDA considered generally safe. They can be added to flavorings, for example, yogurts and gelatins. Usually raspberry flavors are the raspberry and strawberry are the flavors that get these added into them, or get, I should say, get the castoreum added, and they're classified as natural ingredients. Now, for those of you who are starting to maybe grab at your stomach and be very concerned that you're eating anal gland secretions from beavers, there's good news, is that anything that's mass produced tends not to use them because they're just too expensive. And milking the anal glands of beavers is difficult to do to be able to get it. So if you are eating, yogurt, raspberry yogurt that is sold in bulk at a name brand grocery store, probably no castoreum in there. However, if you also have a bottle of high-end perfume on your shelf or cologne, it very well may contain beaver anal gland secretions. So there you go, another fun fact for a cocktail party. So back to our dogs and what they like. So, I look at that list, I think roses, I think blueberries, and start to think about when we have odors in our clinics, or, once again, if you are involved in any kind of product development or picking a shampoo off the shelf, if it says it's maybe rose kind of scented for your dog, that may be something that might be more pleasant for the dog. And then, of course, pheromones for dogs as well. We talked about feel-away, and DAP was the first name of what then became Adaptil, and now I see is maybe changing names again to Thunderies, but all the same product. This study was done when it was called dog appeasing pheromone. 15 dogs who were fearful of the vet visits. They had placebo visits and DAP visits, and when they had the DAP visit, they had reduced anxiety and increased relaxation. So a plug out there for those two products. And I will say that not all pheromones are created equal, and the data that is published tends to be on feel-away and DAP, Adaptil, and the now called Thunder-Ease. And so those are, I always follow the data, try to follow the science. So those are going to be the products, pheromone products, that I recommended in my practice. So we've talked about odors and kind of the relationship in dogs and cats with them. What about clinic odors? How do we manage those? Well, hopefully COVID has taught us to wash our hands more, and we certainly should be washing our hands between patients, not only for disease transmission to minimize that, but also to minimize odor transmission. Our equipment, are we cleaning it? I know that probably you are, because you're fear-free certified practices out there and fear-free conscious about what you should be doing, but I know a lot of clinics don't do that. And of course, accelerated hydrogen peroxide is probably our best choice, just from a standpoint of being able to disinfect appropriately for many of the pathogens that we're concerned about, but also having very neutral odor. That said, if you are going to use bleach, obviously dilute appropriately and recognize that you can cause nose blindness, or that overwhelming kind of nose blindness of the bleach odor getting into the nasal passages. Back to scented cleansers, should we be using them? And we don't know, obviously, every cleanser and what its scent is, and the impact it may have on our patient population. But generally, I probably would err towards unscented cleaning products and supplies. Maybe if I had to get a scented one, once again, if I'm dealing with dogs, rose may be up there, maybe lavender would be a good scent to use. I think about our laundry that we're doing in our clinics, and if we have dryer sheets that are heavily scented, could those be problematic for our patient population when they're exposed to them, even overwhelming for them? And of course, managing odors in the clinic. We know that probably a closed lid is going to kind of contain odors better than an open garbage can. I know it's a little trickier to get things in there, but we don't necessarily want odors diffusing in the clinic. Picking up that excrement on our property is important. And I'm a big fan of a no perfume policy. I think once again, those can be somewhat overwhelming. And of course, there's other odors that sometimes we can have on us through our activities, or our clients that can also perhaps be problematic for our pets. So cigarette odor, etc. And of course, anytime we're maybe working with our pets and we're trying to maybe get a venipuncture and we're using alcohol, the odor associated with that may be overwhelming. So trying to maybe consider using water instead of alcohol in those scenarios. So we've just talked about part of the puzzle, right? So the part of the puzzle of learning a little bit more about the science behind olfaction and the scents and odors that we use or could use and expose to our patient population to have a better veterinary experience, a more fear-free veterinary experience, lower fear, anxiety, and stress. But there's also the component of just saying, hey, how do we protect that olfactory system in our patient population? That's important too. And that's where I want just to spend a few moments talking about vaccination for respiratory pathogens in our patient population. Of course, Elanco has a wonderful line of vaccines. The TruCan and TruFel line are our feline and canine, respectively, vaccine lines. And we are the proud sponsor of the biologics, an exclusive sponsor for fear-free of the biologics category. And in part, that's because of the way our vaccines are designed. They are designed to offer a fear-free experience for our patient population. So it's good for pets, pet owners, and of course, veterinarians, and really associates and everyone at the veterinary hospital, for pets to have the least stressful experience that they can have in our practices. For some of you, you might be saying TruCan and TruFel, those aren't your vaccines at Elanco. And we did last year undergo a rebranding exercise. So many of you have been using these under some other names historically, our Ultra, Filovax, Duramune line, but now we have a simplified naming system, nomenclature system, and the same purity and safety in the vaccines. The packaging is going to be a little easier too for you guys in the fridge when we have this consistency in naming. So one of the reasons I love our vaccines so much is that we really are at the forefront of innovation. And we were the first vaccine brand to update our parvo vaccine strains. We're the first to offer an oral Bordetella, first to offer highly purified 0.5 ml lines for both canine and felines. And we're also the first to and only vaccine brand to offer updated calicivirus strains. So I'm going to focus in on a couple of these respiratory pathogens as I just pull out a couple highlights for you of those our vaccine lines. So when we think about our highly purified vaccine line, that does allow us in the ultra category to offer a 0.5 ml volume. So that's less volume means less pressure, less time injecting, and it offers just, once again, the I think best vaccine experience that I would want for myself, and certainly I want for my pets. We also have combination vaccines. So as we're doing that kind of upper respiratory pan-Luc vaccine, if they're also due for a feline leukemia vaccine, they can get all of those in one injection in a 0.5 ml volume. So to spend just a few minutes on calicivirus, as you probably recall, it's a single-stranded RNA virus. It's very hard to kill. Normal veterinary disinfectants are very ineffective, and it's pretty hardy virus there in sub-freezing temperatures surviving. It also mutates a lot. And there are hundreds of strains of feline calicivirus out there. We think about COVID and all the strains that have happened subsequently. Well, calicivirus is multiples of that. Lots and lots of strains. And some of them are subclinical, and some of them now we know are virulent and systemic. So we tend to think of calicivirus as being a upper respiratory, kind of that moderate, mild, maybe URI, upper respiratory infection, but there are strains of calicivirus that actually go systemically, and despite heroic efforts to try save those cats, many of those cats will die because it's just, once again, goes systemically, and we cannot get them back even with full supportive care. So little bit of background, things I didn't know until I got over into the industry side, is that most feline calicivirus vaccines, so in our combo kind of upper respiratory package, they have one strain of calicivirus. And what they're relying upon is that cross protection. So that one strain that's in the vaccine will give cross protection for the circulating strains in the environment. And when these vaccines were first introduced with a single strain, they got great cross protection, up here at about 90%, so 88%. But as you can see over the decades, that has dropped off. Well, Elanco looked at that and said, that's not okay. We want to boost our cross protection. And so they added a second calicivirus strain to our upper respiratory vaccines in our kitties. And what we did was we were able to boost that cross protection back up to 70%. And so it had fallen to 23% in one of the most recent studies of cross protection with single strain vaccines. And so that dual strain calicivirus boosts that protection. So we have that in a 0.5 ml non-adjuvanted vaccine with that pure fill technology. So all the good fear-free pieces in there, and then great respiratory pathogen protection. There's a series of papers that you can look at and refer to if you're interested in reading a little bit more about it, but it's grounded in science. And in fact, if you look at the AFP guidelines, they state dual strain calicivirus vaccines. And I remind you that Elanco is the only company that provides that, may offer broader cross protection, which is what we want against that nasty upper respiratory virus that sometimes can be very, very deadly. And then with our canine line, with our respiratory vaccinations, I'll point out that Elanco was the first oral Bordetella vaccine. So we were able to go from the intranasal, which I think all of us would agree is not a fear-free experience, introduce an oral Bordetella vaccine, and demonstrate its great efficacy and safety in the real world. So you can see that when we give dogs our oral TruCan oral BB vaccine and then challenge them with Bordetella, that the control dogs all get sick, but 93% of our vaccinated TruCan B oral dogs are do well. So they are healthy. So it's exactly what we want for our patient population. I will mention there is some newer other options out there. A mist, as a behaviorist, I haven't tried it, but this is not an Elanco vaccine, but a mist vaccine, an oral mist vaccine. I just, as a behaviorist, I have pause, because I know that historically spraying things in the mouths of dogs often would be considered a punishment for the dog. They find it aversive, and not that we use that. I don't like ever doing that, because I think it can make a negative association with the person who's doing it. So I don't, even if it wasn't a vaccine, it was just a technique people are using. But like the Bianca mouth spray, people used to do that to punish dogs. And I never recommend that, because I don't want it to be a negative experience for our pets associated with a human right there. So again, we have lots of studies to support the efficacy of the oral Bordetella. And back to that 0.5 ml highly purified vaccine lines that we are offering in our canine and feline lines. 99% of pet owners said it's important for their vet to use that for that better experience. So happy pets mean happy owners and happy vets as well. So as we wrap up tonight, I'll just kind of have a summary slide here that we have for the species, be scent aware, that cats like silver vine gall, catnip, and dogs, maybe lavender would be a good choice. And now you have a couple of other options out there, rose, blueberries. Use your pheromones, and then avoid overwhelming odors. And of course, you do have a choice in vaccines, and I always encourage you to make the fear-free choice, and TruFel Ultra and TruCan Ultra, that 0.5 ml option that we offer is a great choice for your patient population. So I thank you for caring so much to be dedicated to the fear-free strategy and philosophy and process in your practices. And I would entertain any questions that we may have.
This was great, Dr. Neilson. Thank you so much. I learned a bunch that I was not aware of. I think the silver vine information that you presented is so interesting, and I'm already starting to think about how we can work that into some things that we recommend. I'm curious, in that study where they didn't notice that cats reacted positively to the owner's clothing, is there a hypothesis on why dogs react or seem to find it comforting and cats don't?
Well, so there's two points there. I actually am not aware, and I'll have to go back and look, but I don't know if there's actually a study proving that dogs actually have demonstrated calmer behavior in the presence of clothing of their owner. So I know we talk about it, we utilize it. Are you aware? I'm not aware of a study.
I'm not either, but I know anecdotally we talk about it all the time, right? We recommend it in practice, and people do. I mean, you did it, I do it, we all do it.
So here's the thing. So maybe it doesn't help dogs, but I think probably the truth of the matter is it probably helps cats and dogs to have that familiar odor scent. I just don't think that we have the ability to assess them with just a behavioral assessment to like tease out that those kind of minor levels of improvement or incremental levels of improvement that if they could fill out a survey and say, hey, was it a little better? They might be like, yeah, it was nice kind of have my mom's, armpit smell there. Like, so I suspect there's still some potential there. It just didn't show up. And once again, I think that's a factor of the fact that we don't have enough sensitive scoring for them.
Yeah, that makes sense.
I'm gonna still bring in my stinky clothes and leave them.
I think it's fine. We do have a few things in the Q&A. This was not a question, but just a comment from Dr. Robin Downing. Just wanted to say hello and said stellar presentation as always. So just wanted to pass along that feedback from Dr. Downing. We do have a question from Michael. With humans, I assume that taste is closely tied with scent. Is this true with dogs and cats? And if so, how?
Yes. So the odor is very important in food, right? So it's a very important part of the feeding situation. So and to get into the kind of neurochemical, I'd have to probably go back and read some papers, but we know that the odor is critically important. So if something smells unappealing to an animal, they may not even try to eat it. So our cats or a dog. So we know that odor is important as part of that scenario as well.
Great. Rachel wanted to know what the concentration of lavender was that was used when you were referencing that.
Yeah, so, and that's going to vary based upon the study. And so there's multiple studies that have been done. And frankly, this is a challenge. It was Rachel, I think you said, to this is that oftentimes they don't actually, in the methodology, it's not well defined. And so, once again, the references were up. I can go back and pull, but you are not going to always be able to identify the intensity of the odor. So, and most of these studies don't really address it. So most of them don't, as you saw, like they don't do like a light lavender, medium lavender, high lavender. So no one's really looked at those very important questions, to your point, Rachel, of when's too much or when's enough too much, or when is it too much? When does it become overwhelming and negative to them? We don't have that level yet. We're still getting into what odors do they like, let alone the nuanced kind of issues with them.
Yeah. And along with that, we had a question that came up during our Facebook group a few weeks ago about essential oils and using those types of aromatherapy around pets. And I know that can be sometimes conflicting with toxicity levels. What are your opinions on that?
So exactly, we have to be careful about potential toxins. And so for most of these situations, oftentimes they would put the odor on a piece of cloth, and those were oftentimes essential oils. But what if a dog eats it? What if a cat eats it or licks it or does those things? So we have to be, that's why when I was doing my studies, I actually put the odor inside that. The reason I used those rollers was that I didn't want the animal to be able to contact the scent in any way, shape, or form, because I was worried about, first of all, getting on them and then compromising the rest of the scents that they would be exposed to, but also just the potential toxicity. Now, when I did my study, I actually worked with a perfumery company in France, actually. Really funny story here too. I originally thought that I was trying to come up with something that cats wouldn't like and what they would like. So fish, I thought they'd like that. And I thought, oh, I'll get them to make, which they did for me, cat poop smell. Because I thought that would be something they wouldn't like they'd find it aversive. Well, here, when I got it, so I got this little bottle of French perfume that smelled like cat poop. And when I introduced it to the cats in some of my pilot work, they were like all like, I think they were trying to figure out whose poop it was. You know, they were interested in it. And I thought, oh, that's not a good negative.
That didn't work.
Negative, yeah, aversive stimuli. And then I was left with this little bottle of cat poop fragrance, which I kept for years because I thought it's a great practical joke item. So anyways, but you know, we do have to be thoughtful about that. I think you're absolutely right on how we deliver those and making sure we don't hurt our pets in the kind of in the framework of trying to create a more pleasant experience for them.
Yeah, we certainly don't want to be causing harm by trying to reduce fear, anxiety, and stress or anything like that. Michael did have a follow-up question. He wanted to know if you can use scents to help dogs and cats that aren't eating well to improve their appetite.
Oh, well, it's going to depend upon why they're not eating well. And so that in the brain, we've got the orexigenic center and the anorexigenic center, and diseases, etc. It's like a little teeter-totter. And if the anorexigenic center is overwhelmed, there may not be the capacity to use a scent to actually change it, right? And so most of the foods that we're offering them already are scented, and probably they're smelling it at powers greater than us. So probably if you have to do a strategy to increase their appetite to try to really get them to eat, you're probably going to use our labeled products like Allura or Entice that are true appetite stimulants. They produce essentially a ghrelin-like, it's caprimorelin, but it's a ghrelin-like hormone, which is what goes up to the brain and tells you to go eat. So you give that orally, and then it takes that, makes them want to go eat, and then they will go eat. Really interesting though, from a training perspective, instead of let's say you have an overweight dog that you want to use positive reinforcement, but you don't want to give him treats. And obviously you can use tiny treats, but there's actually, and I can't remember the trade name of it, but there's like scent of meat. So you can just spray it's not even maybe it was a little bit of but it was just like a little scent of meat odor. So if they did something right, they got the smell. Now you could argue that's like a laser toy for cats, right? Like they chase it and then they get frustrated because they can't actually ever catch something. Is there a frustration level that could be associated with that? And that has not been considered or looked at in any really good way for us to say, oh, are we just going to make them frustrated?
Yeah.
I can just imagine like smelling pizza, but not being able to eat it,
but
right?
not being able to eat it, like it never appears. You just smell it in the air. That would get frustrating for me if it happened all the time. But along those lines, Beth had a comment about a positive reinforcement sort of scenario. And she said that something she has done is get the scent of the veterinary office for the pet parent to bring home and then have them associate that scent with chicken or some other high value treat so that to create a positive reinforcement. Thoughts on that?
Oh my God, I love this because it's, we always think about trying to kind of hide the veterinary scent.
Right.
What if you're just like, let's embrace our veterinary smell,
right?
And then make it happen at times when it's not a negative association in any way, shape, or form, and we make it even a positive. I guess my big question is, how do you capture the veterinary hospital scent? Like what, but like maybe you just leave something out and say it probably goes along with it, or maybe you spray something that you use at the clinic. Like, what a great idea. I love it. So
Beth did correct me. She said the actual veterinarian and not the office. So they will get like the scent from the veterinarian themselves. Even better.
Well, yeah. Now I'm thinking of all then I thought, wow, that's pretty neat. But hopefully they're on they're working the day the dog or cat comes in. It's not some other
Right.
vet.
It'd have to be a single doctor practice. So, but that's a really interesting idea because yeah, you could almost, create like bandanas or something like that you could take home with the scent of the veterinarian on it to kind of help desensitize and create that positive reinforcement. I love it.
Isn't that great? It's like almost reverse psychology in a way.
Yeah.
Like we've, like just saying, hey, we're going to make me fabulous. You're going to come in and you're going to think I'm
Right. And
fabulous.
it's not a strange thing. It's like they already knew you. So it's not, I love that idea. That's great.
So creative. I love it.
Yeah. Awesome. Looks like that may be all the questions we have. This was wonderful, Dr. Neilson. I mean, truly, I've learned a lot from this. I personally have used the vaccines, the TrueCan and TrueFeel vaccines, and I agree they definitely align with the fear-free experience. That smaller volume, the oral Bordetella vaccine is fantastic. I mean, nobody wants to get sprayed in the face with a vaccine. I think every veterinarian and technician jokes that they've been vaccinated for Bordetella more times than the pet actually has, because they just sneeze it back on you and you're like, that was fun. So yes, great points about the vaccines and how they really align with fear-free. But this was wonderful. Really appreciate everyone taking their time tonight to come on. Dr. Neilson, thank you for taking your time in Charlotte. Had I known you were going to be so close, we could have, done this together in person, hosted. But this was great, and we will, like I said, we will post this on the Education Library. And I hope everyone has a wonderful evening.
Thank you.
Bye, everybody.